Hello everyone. Today our next topic will be from hematology, pathology, second year. It is also a short note in our pathology exam. It is thalassemia. It's a hereditary disorder. As the name suggests, it's a hematological disorder. So it's not from any causative reasons, but it is hereditary. Reduced synthesis of one or more globin polypeptide chains, that is thalassemia. Reduced synthesis of one or more of the globin polypeptide chain. This is the value part. This must be in your answer to gain point. It gives you marks here. Quantitative abnormality of polypeptide globin chain synthesis. It is a quantitative abnormality of the polypeptide globin chain synthesis. Next, these two are the value points, this and this. Next is Mediterranean anemia. Thalassemia is also called as Mediterranean anemia because it was first seen in Mediterranean people. Next value point. Genetics of thalassemia. My picture description is just for understanding purpose. Do not attempt it on exams, please. Genetics of thalassemia is there will be two beta globin genes. Inherited, it is in an inherited individual on two chromosomes. There will be each of beta globin genes on each, and on chromosome 16 each, there will be each alpha globin genes. In a normal case, it is an alpha to beta 2 gene. Hence, alpha and beta thalassemia names came. Now, what is an alpha thalassemia? Normal structure will be there for that, but the production will be impaired. Alpha gene production will be impaired. Same with this, there will be normal structure, but production is impaired. Next is two types, alpha and beta minor thalassemia, alpha and beta major thalassemia. Writing this gives you again value point. Genetics also gives you value point. Next is the pathophysiology. The main part in any pathology is this portion. In any disorders, pathophysiology should be studied. It cannot be eliminated because it gives you the most points in that. Alpha thalassemia and beta thalassemia. Alpha thalassemia major is the inability to synthesize adult hemoglobin. Beta thalassemia major is premature red cell destruction due to erythromembrane damage. The red cells are destructed due to the erythromembrane's damage by alpha globin chain. Next, alpha thalassemia. Now I will tell the molecular pathogenesis. Molecular pathogenesis. It is the defective synthesis of alpha globin chain which results in decreased production of hemoglobin with alpha chain. Causes the decreased production of hemoglobin with alpha chain, giving rise to HbA, HbA2 and HbF in the bloodstream. It is a defective synthesis of alpha globin chain, as the name suggests, alpha thalassemia. Pair of alpha genes determines another types, these four types. So the pair of alpha genes, depending upon the clinical manifestation, the number of the genes deleted gives us four types. Depending on the number of genes deleted in the clinical manifestation produces these disorders. First one is 4 alpha gene deletion, 3 alpha gene, 2 alpha gene, 1 alpha gene deletion. 4 alpha gene deletion causes HB Bart's hydrops fetalis, 3 causes HBH disease, 2 causes alpha thalassemia trait, and 1 causes alpha thalassemia trait carrier. Beta thalassemia. These points also gives you mark here. Beta thalassemia. Molecular pathogenesis, reduced rate of beta chain synthesis. Main, at least in alpha and beta thalassemia, just write down simple. In alpha thalassemia, defective synthesis of alpha globin chain. In Beta thalassemia, reduced rate of beta chain synthesis. In both cases, synthesis is reduced, leading to reduced formation of HbA in red cell. HbA is reduced in red cell. That gives you mark here. Only seen in this beta thalassemia is only seen in a condition called hereditary persistence of fetal hemoglobin. Gives you again mark here if you add this point. Depending on the extent of reduction in beta gene synthesis, there are again 3 types. On the reduction in beta gene synthesis, 3 types. Homozygous form, beta thalassemia intermedia, heterozygous form, beta thalassemia minor, also called as beta thalassemia minor. This homozygous form has again 2 parts. It's again divided into 2, beta thalassemia major, beta plus thalassemia major. These points also give you mark. Types are unique mark carrying points in pathology. Next we'll talk about is beta thalassemia major. Beta thalassemia major. Beta thalassemia major, also called as Mediterranean or Cooley's anemia. This Cooley's anemia is also asked as another question, Cooley's anemia. So it comes under beta thalassemia major. When Cooley's anemia is only asked, just write these points. But you have to add all these points into your question as thalassemia if it is asked. It is a congenital anemia, again seen during birth, as I told, it's hereditary. Complete or small amount of beta chain synthesis takes place. Complete or small amount of beta chain synthesis takes place. The clinical features are anemia is seen at the early ages of the life. That means in the case of a baby of 4 to 6 months, there will be hepatosplenomegaly and there will be expansion bones. Hepatosplenomegaly means liver and spleen are both enlarged. Expansion of bones and iron overload. Next is lab finding. Lab finding shows anemia, as the name suggests. Next, microscopic hypochromic red cell, reticulocytosis, and WBC count will be increased and increased in HbF and HbA1A2, as I said earlier. The treatment will be at regular intervals. There will be blood transfusion needed and a folic acid supplement and splenectomy in a case after 6 years, in a child after 6 years of age, and chelation therapy, and in rare cases cord blood transfusion also. So when Cooley's anemia is asked, at least involve these points, it will give you marks. Beta thalassemia major, also called as Mediterranean anemia, Cooley's anemia. This is the most important, gives you mark. Next you have to say about what it is, clinical features, lab finding, treatment. Finish. Next is beta thalassemia minor. There will be moderate reduced in beta gene synthesis. Clinical features, beta thalassemia minor is asymptomatic. That means there will be normally no symptoms seen, but spleen will be palpable at times. Lab findings. Why is everything related to spleen? Is because everything is hematology and red cells are related to coming under spleen. All the red cell functions, synthesis, everything comes under spleen. Lab findings. There will be mild anemia, reticulocytosis, diagnosis by, it is a confirmatory diagnosis by hemoglobin electrophoresis. Must include, this is again a value giving point. Next is treatment. Treatment is by, in chance, there is no treatment to this as it is asymptomatic and rarely found, but you have to mention in the family that there are chances of genetic involvement in the family member. Prevention is, as it is a hereditary disorder, the antenatal diagnosis can be done in the early ages of a child or a baby, neonate. Chorionic villus biopsy also is done in the prenatal, in the case of a neonatal. So this is it. Involve all these points when thalassemia is asked, and when Cooley's anemia is asked, just involve the points up to treatment I have said. Thank you.